Supreme Court ruling on abortion medication still up in the air. Oregon's governor announcing the state has stashed away a 3-year supply of the drug mifepristone.
And there is a lot to this national issue, although digging deeper into what this means for local patients and providers, let's get to our Joelle Jones, who's live now with the latest.
Jeff, Liz, the abortion and miscarriage management drug has been FDA approved since 2000. But after recent challenges in the courts, providers tell us access to the medication has become a concern. That is, until today. Patients and providers breathing a sigh of relief tonight after Oregon Governor Tina Kotek announced in partnership with OHSU, the state has secured a 3-year supply of the abortion and miscarriage management medication mifepristone.
This is an incredibly important move both for patients and providers in the state who may not even provide abortion care, but might provide miscarriage management or care of patients undergoing pregnancy complications.
Dr. Allison Edelman, professor of OBGYN, tells us a stock of more than 22,000 doses of the FDA-approved drug arrived in Oregon today, with the Oregon Health Authority now tasked with equitable distribution. Following in Washington's footsteps, Kotek's announcement comes one day before the Supreme Court is expected to weigh in on the issue after a Texas lower court decision to ban the drug was appealed earlier this month, with Governor Kotek stating in part today, by challenging the FDA's authority over mifepristone, the lower court decision set an alarming precedent of putting politics above established science, medical evidence, and patients' health, life, and well-being. We cannot afford to stand by and watch our fundamental right to reproductive health care be stripped away.
We know firsthand that these kinds of cruel and restrictive laws impact people who already experience the greatest barriers to care. So for right now, PPCW is providing all services as normal. Our health centers are open, and we will continue to provide access to care to everyone who needs it.
Kenji Nozaki, Chief Operating Officer of Planned Parenthood Columbia-Willamette, tells us they are grateful to the governor for securing access to mifepristone.
Mifepristone is a safe and effective medication for abortion and miscarriage management, and that it has been used by more than 5 million people since the FDA approved it more than 20 years ago.
And the Supreme Court's extended pause on the lower court's ruling is expected to end tomorrow night at midnight. So, of course, we will continue to follow this and bring any updates as it develops. Reporting live in Portland, I'm Joelle Jones, KOIN 6 News.